Good morning. This is Dr. Amiry. Today we're going to talk about the hyperdilute radiesse. Hyperdilute radiesse is used for a variety of conditions. For loose skin, overall just it produces the collagen by injecting it, a really dilute amount of radiesse. And so we'll go through the whole presentation in terms of what it really can and cannot do. So let's look through some slides here. Okay, so that's this is a patient that had these fine lines on her chest, but also she had laxity of her neck. So you cannot really see that, but we'll definitely show the before and after. And so the way it works is, so we map the process first of all. Anything that I do is always very careful not to start a procedure unless I have the whole plan in mind. Otherwise, I think it's messing with a procedure that actually may not produce the results. And then so I map out all the injection points, especially when it comes to radiesse or the hyperdilute radiesse. But I really do that with a lot of my procedures now. I mean, the more I have proceeded in my career, the more methodical I have become. And I believe that prevents random results, and it makes it more uniform and more predictable. The method of injection is we're using a cannula in this case, and a cannula is a blunt needle that's much longer, about 1.5 to 2 inches, and the advantage of that is, one is that we can spread the hyperdilute radiesse in a larger area, and the second thing is that it's also much safer as well. So we use the method that we use is what's called fanning, and fanning is really the process of spreading the hyperdilute radiesse. As you can see in this video, it's going in these different directions and fanning it, so it's like a fan really. So spreading it just really hyperdilute amount, and then injecting it all over the area. So we inject it in this area, which is the upper chest, lower chest area, right in this area, and then the same thing on the other side. So one of the advantage of this is also that we don't want to put too much in one area, because it can form what's called nodules, where you have a small golf ball like nodules that form in one area. So this procedure actually prevents them from happening. We use what's called tunneling method, which is when we go into a certain area, what I want to make sure that it forms a tunnel, and when I press the needle or the cannula down. And the idea behind that is that it makes sure that it's actually more superficial rather than a deeper injection. And so if it forms a tunnel, that means that it's superficial enough to be injected. So it does need to be injected in the right plane, so it cannot be too deep, because if it's more what's called sub-Q right under the skin, it will cause the production of collagen, and that's where it has the most benefit. So the outcome of that is, of course, it tightens up the skin, reduces it, improves wrinkles and laxity of skin. Okay, so let's go to the next slide. So this another area was really the neck area. So the neck area, there are a couple areas where it really needs to be injected. One is right underneath the chin, which you can see right here. So again, the fanning method is being outlined here. And then the other one is right at the angle of the jaw and going into those areas. And as you may see here, there's a little bit of tunneling or fanning that's taking place here. It's more of a tunnel. And again, the idea for that is that, so you want to be superficial enough, and that ensures that I'm superficial enough. Although I marked it here, but I didn't inject it here, and the reason is because her trachea or the windpipe is right here. And if you go over that area, it could just be placed too superficially. So I didn't do it here, it was just here in this area. And in her case, for the neck, we needed only one syringe. And I think for the chest, we needed, I believe, 1 to 2 syringes what we need for the chest. For the neck, I think it's almost 1 syringe. The results take about 6 to 8 weeks to notice any improvement. Although even in 2 weeks, you will see the before and after. She's experiencing significant improvement, both in terms of the tightening. You just don't see the fine lines anymore. Some of it may just be swelling, but we'll follow up with you in terms of what this really looks like in about 6 to 8 weeks or so. And so the number of treatments that it takes is 2 to 4 treatments. So the procedure, in her case, it took about an hour, both for the chest and as well as for the neck. But I think if we just did the neck, it would probably take me 20 to 30 minutes. So which area can be injected? So this is a great procedure for the chest, neck, legs, face and buttocks and arms. Like some people have these butt wing deformity, or they have these bat wing deformity, or they have these loose skin on the arms, but also laxity of the skin or the loose skin on the legs as well. For all of that, or even on the stomach for stretch marks, it's actually a great procedure as well. So it could be used for all of that, or even on the face. It just provides really a fine layer of collagen formation under the skin. This is not for volumization. This is more just improving the appearance of skin and tightening things up. So this is showing the same procedure in terms of how it's really being done. As you can see, it's just going in all different directions. So it's the fanning technique. So it's just one area. And so this is the before and after. You can see. So what I see here is, and hopefully you can appreciate that, one is to take a look at here under her neck, or the double chin area. So a lot more reduced. And that was a major concern for her. The other is also to notice the texture of the skin, and that might be hard for you to appreciate. Actually, you could probably see it pretty well, but again, in pictures it's a little difficult, but you can see that there is significant improvement. Let's take a look at the chest area as well. And this is the chest area. So a lot more improvement. You can still see the bruising here from 2 weeks ago, and the bruising can last up to about 2 weeks, and that should be the tail end of it. But you can see here these fine lines. And then in the after picture, you don't see any of that at all. So in conclusion, this procedure, so again, just to reiterate, this is for skin laxity, loose skin, double chin. You can use it for the laxity of the arms, stomach, legs. It can improve fine lines on the face and as well as the chest. And the result is a youthful appearance and plumper skin. So if you're interested, just make an appointment and let's talk about it. And in terms of whether, I do a variety of things. I mean, sometimes laser is a better answer, especially for skin texture and tone, but sometimes for something like improving skin laxity or fine lines, this could also be a great procedure. So it really depends. You need a formal consultation to really decide that. So I hope that was helpful to you, and we look forward to talking to you in person.